just pretty much here to talk to you about how balance affects everyone. I mean, I'm sure it affects everyone in different ways, or someone knows someone who's been affected by a fall or something like that. So we're just here to talk about how it happens, what some of the causes might be, and how PT would help. The reasons, I should say. Your body has different systems. It has your balance system, muscular system, vestibular system, which is also kind of incorporates balance as well. So it can happen because sometimes the aging process does play a factor. Sometimes weakness, instability in the joints and the muscles around the joint also play a part in it. And what we kind of do is aim to strengthen, work on balance, endurance, get the muscles working right, so that those different muscles that help you stay upright and help kind of catch yourself when you lose balance, I should say. Those muscles are strong enough and stable enough to help. So it says 36 million falls are reported, resulting in more than 32,000 deaths a year. So it's a lot. It happens quite often, as I'm sure you can imagine. People fall a lot, and a lot of people don't know why they've fallen or what they can do to help. And it's pretty scary sometimes if you fall and no one's around to help you, for instance, or if you fall and you can, even worse, like break your hip or break a bone or something, and that can lead to a lot of other issues, as it says right there. Consequences would be fracture, surgery, even brain injury, depending, like I said, on how you fall or where you fall. If you fall on your head, or you fall on the back of your head, you fall on the concrete outside, that could be pretty serious as well. This is kind of what can be done as far as after you fall, or even to prevent you falling. So here in physical therapy, we do a lot. We kind of try to prevent it first from happening, which is what I talked about in the beginning, is making sure your balance is okay, doing different tests, and strengthening those muscles around the joint to make sure those muscles are good to kind of prevent you from falling, because there are different parts of your body, your lower body, especially like your calves and your quad and ankle especially. Get that part of your body stable. It'll help you a lot more to prevent the fall. And then also just keeping everything around you safe. Let's say you're at home and you live alone. Try to make sure the area is clear. Try to make sure you have stuff to hold on to when you're walking around. Try to also have the right footwear on. Sometimes if you're walking on hardwood flooring or something, it could be slippery. If you have slip socks on, you can slip and fall. Typically we do, a lot of the patients here do, advise them to wear the non-slip socks. They have like the padding underneath. That does help prevent that as well. And we do also work on body mechanics. That's very important here too. We just want to teach you the movements to avoid doing, or doing them properly, because some people will, let's say they bend down and pick something up, they'll bend down like this, come back real quickly, come back up, and then before you know it, they'll be really dizzy and they might get a little off balance. The same thing with getting out of bed, getting in and out of bed. There's different ways to do that. You don't want to, shoot right up out of bed, or because also that can put a lot of strain on your back as well too, depending on how you get up and out. And then just getting lightheaded, that's a big thing too, that when you get up out of bed real quick, you can just get that blood rush to your head and get lightheaded, and that some people can just go back, you just end up falling back, you have really no control over it. And other interventions that can be done is from the medical point of view, medication and surgery, but we try to leave that as a last resort. Here we try to do what we can do here first in PT, and we leave the medication and surgery stuff till the last resort. That shouldn't really be necessary unless something's very serious. As you can see in the picture, the top one is just a picture of a patient on a stability ball, or Swiss ball, whatever you want to call it. We do exercises with patients on here. It's a little higher level, but you can see the objective is to just kind of challenge your body and challenge different systems in your body that play a part in balance. And then the second one is a man. I don't know if you can tell, but he's crossing over like cones or some kind of like obstacles. So that's also something that we do. Most people can do this with supervision of a therapist behind them, or holding onto them, or some kind of area to hold on to. That should be fine.